Diagnosis first and then the answer. Now, when you see this picture, you could almost say the entire anterior spinal artery is occluded, isn't it, folks? So this is exactly what we have in the book. So the only track that works is a dorsal column. Is that clear, folks? Now you see what you want to pick here. Crude touch, pain sensation, proprioception, motor function. Out of all these four, which belongs to dorsal column? Proprioception. So that's the only one functioning. Except proprioception, everything is decreased. Okay, so that's the idea here, folks. Everybody clear? All right. That's the key, anterior cord syndrome. All good? It is 18680. Get me the diagnosis, then I will show you the picture. Give me the diagnosis. What do we call that? So it's a vitamin B12 deficiency. What do we call that then? Subacute combined degeneration. Okay, so it's a subacute combined degeneration. Where did we see this? 54-year-old woman is evaluated in the clinic due to EC fatigue. The patient has had no weight gain or cold intolerance. They're trying to rule out thyroid disease. Medical history is significant for gastrectomy due to non-healing gastric ulcer. Gastrectomy gives you no intrinsic factor. Okay, when you do gastrectomy, no intrinsic factor, so no B12 absorption. Is that clear, folks? All right. Now, physical exam shows the shiny tongue and all these things, okay? The patient's gait is unstable when her eyes are closed. That's dorsal column. And also says vibration senses decrease in the upper and lower, okay? There is the mild symmetric loss of muscle, that's corticospinal tract. And they didn't talk about spinocerebellar because they don't want to give all of them to you, but they give hemoglobin level. So patient has anemia here, folks. So that should confirm subacute combined degeneration. Okay. So in subacute combined, 3 tracks: spinocerebellar, dorsal column, and corticospinal. In what is A? Give me a diagnosis for A. What's the name for A? Type it, type it. Not spinomuscular atrophy. Okay, you could say spinomuscular. Okay, because it's bilateral. Okay. If it is a unilateral, you would say polio. Okay, folks. All right. What about B? We haven't studied so far B, but see, at least tell me what are the structure involved. Dorsal column, spinothalamic, and you're both, this is actually a multiple sclerosis. Okay, now we'll talk about multiple sclerosis separate because they're covered separately. Okay, so that's that. What about C? Diagnosis, tabes dorsalis. What about E? What is E? Stringomyelia. Okay, so then that rules in D, dorsal column, spinocerebellar, and corticospinal. Is that clear, folks? a little different picture, but that's the answer. You see that.
Doctor, quick question. Like, okay, I think when we think about motor, we think of movement. So can you explain the relation between strength and that being a cortical tract? You said that
because if you see symmetrical loss of strength affecting, right? In order to do a move, you need a strong muscle. If I ask you to move your hand, and if you are moving so weak, that's a weak movement, even though you have a motor function, but it's not strong enough. So to do a good movement, the muscle has to be good strength.
Okay, and how would this indicate corticospinal?
Because the only tract that is responsible for motor is corticospinal tract.
Got you. Thank you.
Yeah. I want diagnosis. What's the diagnosis? This is stringomyelia. Did we get that? How do we know it's a stringomyelia? Look at this. The patient is concerned because she cannot feel when the objects are really hot and often doesn't notice that she has a burn until she look at it. So she doesn't have a pain. No pain, or she cannot feel the temperature. Is that clear, folks? When you burn yourself, you feel both temperature and pain, isn't it, folks? She's not getting both. So that's a pure spinothalamic tract problem. But the question here you should ask, is it unilateral or bilateral? Bilateral, both sides are affected here. So if it is bilateral, the only place is anterior commissure. That's where it crosses both sides, folks. Stringomyelia affects right here. A is the right answer. Okay, now D, what is D here? Let's see here what they say on their diagram. See, D is basically individual. If the patient says they have only one side of the body has burned, then you could go for D. But the minute they have bilateral, for exam purpose, it's always bilateral, because we don't have a disease that can affect only one side. We can't just make up a disease, right? Stringomyelia always affects bilateral. Is everybody clear, folks? All right. I want what this patient has and what's the answer. This patient has Friedreich's ataxia. Did we get that? Okay, so this patient has Friedreich's ataxia. MRI shows degeneration of the posterior column and spinocerebellar tract. They didn't talk about corticospinal. I'm sure they gave some other hints. 16-year-old boy is evaluated for gait instability, dysmetria, dysarthria. Okay. The patient enjoys basketball but can no longer play due to worsening symptom. He's worried because his brother developed similar symptom and died at age 21. With these two tracks, and they are trying to tell the person had a hypertrophic cardiomyopathy. Does that make sense, folks? So that's enough. That's Friedreich's ataxia. Look at this. You will get the diagnosis. Sometimes you don't know the answer. Which disease has closely resemble? You should look for vitamin B12 deficiency or E deficiency. Only E is the right answer. Is that clear, folks? See, no matter how much you know about Friedreich's, but if you cannot differentiate, then you lose this question. Okay, so that's that, folks. Vitamin E deficiency. Okay, 38% of the people get this question right because most of the books don't mention that. Okay, so are we clear here, folks? Okay. 15-year-old boy is brought to the office by his mother due to difficulty with movement. The patient enjoys playing high school basketball but had to leave the team this year due to progressive worsening symptoms. They have kyphoscoliosis, pes cavus, that's high plantar arch. And they also say the brother suffered similar neurologic and died of a heart failure, that's hypertrophic cardiomyopathy. You can't get better question than this, folks. Okay, that's Friedreich's ataxia. What's the answer? Degeneration of spinocerebellar tract. What is A? Wayne, what do you think A is? You are the first one on the camera. I'm just going on that order. What is A? Atrophy of the caudate nucleus. There's only one disease. Abby, what is it?
Huntington?
I didn't hear anything.
Huntington?
Huntington, there you go. Yeah. I think after you finish the fasting, all I see you are eating. That's why your throat is messed up.
I'm drinking coffee.
It's okay. What is B? Anybody? Raimonda?
Alzheimer's?
Very good. That's Alzheimer's. Cerebral cortex atrophy, diffuse, the whole thing. Okay. Demyelination of peripheral nerve. Carrie?
Is it MS?
No. MS is central nervous system, not peripheral. Can you think something similar to MS, but it's in the peripheral nervous system? Guillain-Barré syndrome.
Is it Gaucher?
Yeah. Guillain-Barré syndrome, because it's, remember, MS is central nervous system. This is peripheral nervous system. What about this one? E. That's either unilateral polio, bilateral spinal muscular dystrophy. Okay. This one, last one.
Parkinson.
Good job, guys. That's Parkinson. Okay. So that's that. All right. Look at that. So that's degeneration of that. All right. Oh, that's too easy. Has to be cardiomyopathy, isn't it, folks? If you think it's Friedreich's ataxia. All right. Same explanation, same thing. That's a baby question. No, not that one. We are not done yet. All right.